Thank you, Patrick, for the introductions. Good afternoon. It's truly a pleasure to be here with all of you today and to join in this important discussion. The work of nurses, as President Obama has said, and I quote, is caring for all of us from the time that they bring life into this world to the moment that they ease the pain of those who pass from it. And perhaps more to the point, I quote that if it weren't for nurses, many Americans in underserved and rural areas would have no access to health care at all. We know that in hospitals and healthcare clinics and community health centers all across the country that you're the healthcare professionals that patients see most often. You're the ones that truly are on the front lines. And as a pediatrician, I've certainly seen that myself in my own medical training and my clinical practice, and now in my role with the Office of Minority Health. I continue to appreciate the tremendous impact that nurses have, not only in the healthcare setting, but in your communities, in academia and research, and in policy. And so when it comes to improving the health of minority and underserved populations, your engagement is absolutely crucial. And as I know you've heard today, and certainly many of you are all experts in this area, and certainly it's what you've seen in your own practice, the unfortunate reality is that health disparities persist in our nation. That minority and underserved populations suffer disproportionately from diseases that are preventable. That they're more likely to suffer from diseases and illnesses resulting from serious conditions like diabetes, heart disease, and cancer. They're less likely to receive access to preventive services to stay healthy, and they're less likely to access quality health care when they are sick. And the office that I have the honor of leading, the Office of Minority Health, was established just to address this purpose, with a mission of improving the health of minority populations by developing health policies and programs that will help us to eliminate health disparities. And from that vantage point, I must tell you that even though these challenges are great, we are at such a pivotal moment for health equity. This is a remarkable time of transformation across our healthcare system, a transformation that is already beginning to benefit those who need it most. What I'd like to do is really provide you with an overview of our department's commitment to reducing disparities and achieving health equity, and I believe that my co-panelists will speak more specifically to the investments and activities within their agencies of HHS and in the external sector. We know that the Affordable Care Act, one of our priority areas, the healthcare law that President Obama signed 2 years ago, includes provisions that will provide better access to care and make healthcare more affordable. And it also recognizes that prevention and wellness are a priority for all Americans, including those who are traditionally underserved. Taken as a whole, the Affordable Care Act is one of the most significant policies that we have had in our nation's history to help us reduce health disparities. Yes, you can clap, that's fine. Supreme Court upheld that too, so you can clap. Under the Affordable Care Act, hopefully you all know as well that offices of minority health were created in 6 agencies throughout the department, including HRSA, led by Michelle Allender-Smith, and that the National Center on Minority Health and Health Disparities was elevated to a full-fledged NIH institute. And it's through these offices that important leadership is being provided in the agencies really to address reducing disparities and achieving health equity. And the Department of Health and Human Services is certainly not stopping there. Just last year, under the leadership of Secretary Sebelius, we released our first ever action plan to reduce racial and ethnic health disparities. What that action plan does is affirm our department's belief that everyone should have the opportunity to reach their full potential for health. And it outlines strategic initiatives to target health disparities. We've passed the 1-year mark of the action plan, and we've seen that it's already making a tremendous difference. We're transforming the healthcare system by reducing disparities in health insurance coverage and access to primary care services. We're advancing the health and well-being of the American people by investing in community-based programs to reduce disparities. We're advancing our scientific knowledge by conducting research and implementing new data collection standards to better understand health disparities and design effective intervention programs to reduce them. And we're working to strengthen the nation's health and human services workforce, certainly the theme that resonates with the focus of this summit. A significant way in which we are strengthening the workforce, in particular the nursing workforce, is the investment and the initiatives administered by HRSA, many that are made possible by the Affordable Care Act, some that are enhanced because of the healthcare law. And I'm sure that you have heard throughout the day about the investments that are being made, and my colleague, Dr. Williams, will likely address some of these areas within HRSA. But in strengthening the health workforce, we also recognize that we must improve the cultural competency and increase the diversity among health professionals. That's an important part of that strategy. And at the Office of Minority Health, we are proud to support these efforts by sponsoring Think Cultural Health, which many of you may be familiar with, a series of continuing education programs and online resources to promote culturally and linguistically appropriate services for diverse communities. We know the demographics of this nation are changing. And while that presents new challenges, it also presents new opportunities in the provision of care. And so it's more important than ever that we help providers, from doctors to social workers to nurses, to become more aware of their own cultural beliefs, more responsive to the needs of their patients, and more alert to the different needs of diverse patient populations. An example of our impact through the Think Cultural Health e-learning programs is that there have been over 40,000 registrants in the field of nursing certification for culturally competent nursing care. And within the Office of Minority Health, I have invested in this area with regards to our umbrella cooperative agreements by identifying one of the 5 priority areas of those cooperative agreements, those funding opportunities, to be workforce development. Another example across our department is the Substance Abuse and Mental Health Services Administration Minority Fellowship Program. This fellowship program is supporting the American Nursing Association to increase the number of nursing graduate students entering the field of behavioral health. And SAMHSA has joined with HRSA in launching the Center for Integrated Health Solutions, which provides resources to primary and behavioral health care providers in the delivery of integrated care, a key strategy in addressing disparities in behavioral health. And in these workforce developments, we also understand that we need partners of all kinds. The National Institute on Minority Health and Health Disparities, for example, is partnering with the Association of American Medical Colleges on the U-Health program, which aims to improve the health of urban communities by developing their health workforce. And I know that you just heard from Dr. Mark Neve, who is truly a champion in this area. U-Health brings together a group of diverse individuals ranging from university presidents to nursing deans to public health professionals dedicated to improving the health of underserved communities by developing their health workforce. These initiatives really reinforce this administration's efforts to advance diversity in our workforce and strengthen opportunities for traditionally underrepresented groups. Just last month, President Obama signed an executive order establishing the White House Initiative on Educational Excellence for African Americans, aimed to ensure that all African American students receive an education that fully prepares them for high school graduation, college completion, and productive careers. So as we look to diversify our workforce, we're not just investing in higher education or those who are already in the profession, but we understand the importance of interventions that address opportunities early in the pipeline. These are just a few of the many examples of federal investments that we're making to address health disparities and strengthen our workforce diversity. And within the Office of Minority Health and across our department, we also understand that the federal government and HHS specifically cannot do this alone. And that is why we have coordinated the National Partnership for Action to End Health Disparities, established to mobilize a nationwide community-driven approach to combating disparities. It embraces the social determinants of health approach, recognizing that our health truly is influenced by where we live, learn, work, and play, and it involves multiple sectors, not just health. It involves transportation, labor, education, justice, and many others. And out of this National Partnership for Action has been created regional health equity councils that exist all across the country, led by community leaders, led by experts in the field who are driving the agenda in their regions, in their states, and in their local communities on how they can combat health disparities. You see, for the first time in our country's history, we have a coordinated roadmap designed to give everyone the chance to reach their full potential for health. We have the tools and the resources that we need to address the gaps that have persisted for so much of our history. What a remarkable moment of opportunity. At the same time, we know that it will not be us alone, that ensuring optimal health for all demands engagement at every level, not just here in Washington, D.C., but in communities all over the country, in health departments, in our universities, in our local health centers, on the front lines. So at the close of this conference, when you leave here, we need you to continue to raise your voice, to continue to raise awareness about the needs for this workforce development. We need to have your voice at the table, and in a healthcare system that is undergoing such change, your work, your advocacy, and your engagement are more important than ever. Thank you very much.